All right, so section 16GG, naloxone or Narcan. We talked about this quite a bit previously already, so we'll just go over what Narcan is. Narcotic antagonist is the class. I would know that. The primary action of interest is reversal of respiratory depression associated with narcotic agents. Naloxone competes with and displaces narcotic substances from opiate receptors. Your indications: respiratory arrest, specific causes of cardiac arrest, altered mental status, syncope, or poisonings, as we've already went over all of that. Contraindications: known or suspected narcotic substance use or abuse without cardiopulmonary compromise, post-intubation in known or suspected narcotic substance use or abuse situations, avoid whenever possible in known or suspected narcotic addicts. In these patients, use the smallest clinically effective dose possible, titrating administration slowly to avoid acute narcotic withdrawal, which we kind of talked about that. Just because the dose is X, Y, or Z doesn't mean you have to start with that dose. Sometimes you have to titrate that up. The goal is just to get them breathing again, not necessarily to wake them completely up. Your onset is within 2 minutes after IV, IO, IN administration with duration of effect up to 2 hours. Side effects: agitation, anxiety, diaphoresis, tachycardia, nausea, vomiting, headache, hypertension, hypotension, or seizures. Your dosage: for respiratory arrest, specific causes of cardiac arrest, altered mental status, syncope, or poisonings. In apnea, agonal breathing, 2 milligrams IV, IO, IN, may repeat once to a max cumulative dose of 4 milligrams. So again, I keep hitting that because that's one of my pet peeves. You don't have to hit them with 2 milligrams right off the bat. You can start at 0.5, start at 1. You just want to get them breathing again. An ineffective breathing acuity, 0.5 milligrams IVIO-IN, may repeat to a maximum cumulative dose of 4 milligrams. So actually says right there. Respiratory arrest, pediatrics, this is going to be all your pediatric ones. It's going to be 0.5 to a max dose of 2. Ineffective breathing, 0.5, max dose of 2. Again, pediatrics, just use your hand heavy. How it's supplied: 0.4 milligrams per 1 milliliter vial, 0.4 milligrams per 1 milliliter pre-filled syringe, 2 milligrams per 2 milliliter pre-filled syringe, 4 milligrams per 10 milliliter vial. So it could be in several different vials. Just make sure you're checking that before you give it to your patient. Special comment: in non-respiratory arrest or non-cardiac arrest situations, always titrate administration slowly using the lowest clinically effective amount of naloxone possible to avoid inadvertent acute narcotic withdrawal and or other side effects. Naloxone should not be administered unless there is a known or suspected narcotic substance use or abuse.